Alright, so to see everything that happened to me regarding my injury, please see my YouTube channel, My Medical Nightmare. Back in May 2022, I tried to contact a doctor whose name appears on the top of my medical records that I got from a misdiagnosed x-ray. Now, Dr. Blake Thomas, MD, he was supposed to be supervising the nurse that facilitated this x-ray for me, Kimberly Kelly. In my x-ray, it was further analyzed by radiologist Dr. Anna Maria Eknick, outsourced through Xperity. I was told I had no injuries appear in this x-ray. I'll put the images up here and you can see that this was not the case. I have a translucent oval about 3 inches in diameter that appears here. And in other MRI and CT that I've had ancillary to this, there is evidence of broken bone in the underside of my skull and infection. This doctor's name appears on his state-issued Alabama medical license as Christopher Blake Thomas. Expiration date 12/31/2022. And yeah, after you listen to this call, if you are charged with extending this doctor's medical license or granting him a new license, please bear in mind what I'm about to present in this video. I found out that this doctor was physically based not at the AFC urgent care clinic where I had my x-ray done, but his practice at the time was located on the other side of Birmingham, Alabama, USA, at 3000 Cahaba Village, Place Suite 110, Birmingham, Alabama 35243. This is also technically the city of Mountain Brook, Alabama. Following my introduction, I will play both calls that I had with a gentleman who identified himself simply by the single name of Sadler, and that's spelled S-A-D-L-E-R. And he identified himself as the office manager of the American Family Care AFC Urgent Care. And when I asked this office manager for his first and last name, he refused to give it to me. Also, you'll hear in my other calls with AFC, almost all of the staff that deals with the public in American Family Care around Birmingham, Alabama, they are using pseudonyms, fake names, and nicknames. They go by single names. They don't use the first and last name. And this is unprofessional in business. This is medically unethical. Alright, so I have a major update in this situation. I did some research and I found out the true identity of the office manager, Sadler, of the Cahaba Village AFC Urgent Care. The person that I was talking to the entire time, this was Dr. Christopher Blake Thomas, MD. Alright, so here I'll show proof that the office manager and state of Alabama licensed physician, Dr. Christopher Blake Thomas, are one and the same individual. And you can verify this for yourself by going to the website of Birmingham, Alabama television station WVTM Channel 13. And I'll include the link in here. They did an interview with Dr. Blake Thomas, July 29, 2021. And there's video and audio of this doctor. And listen and watch this, and then go listen to my recorded phone calls. And it's the exact same voice. In this report, it was done by anchor Sarah Killian.
infection. And that's why he's encouraging patients with these symptoms, whether they're vaccinated or not, to get tested.
Is not the time to be chalking this up to your typical, I get a sinus infection this time of year or an allergy flare-up. If you have any of those symptoms, you really should get tested because you don't want to find out after the fact that you were positive.
Now, Dr. Thomas...
AFC Cahaba Village, how can I help you?
Yes, sir. Who am I speaking with?
My name is Sadler. I'm the office manager here.
Okay.
Cahaba Village location.
Yes, sir. I was waiting to talk to Dr. Blake Thomas, MD.
Okay. I believe the lady up front was talking with you, and I heard her say that
Is not the time to be chalking this up to your typical, I get a sinus infection this time of year or an allergy flare-up. If you have any of those symptoms, you really should get tested because you don't want to find out after the fact that you were positive.
And yeah, it's totally unacceptable that this doctor is allowed to operate in this location, not reveal his true name to people that he is speaking with, patients that had been under his care, such as myself. And yeah, another thing this doctor is doing, he's posing under different assumed identities, false identities. He is a doctor. He's not an office manager. People out here on the street, we don't have time to play these games with these millionaire doctors, all right? Up there on Highway 280, Mountain Brook, you think you got standards and you're protected by the illusion of wealth. As you'll see in many of my videos, what I've discovered trying to pursue recourse in a major case of medical misdiagnosis is that doctors and nurses out there, they're so used to telling people anything and getting away with it and getting by with it that they just keep on because they think they're not going to get caught. So please listen to my discourse with this medical clinic office manager with this new knowledge, misrepresenting himself and failing to disclose his identity as a licensed medical practitioner in the state of Alabama.
Welcome to American Family Care. The right care, right now.
Let's see, how can I help you?
Yes, ma'am. I'm trying to get in touch with Dr. Blake Thomas.
He's currently with patients. Can he return your call?
Yeah, you know, this is the third day I've been trying to call and talk to him. If I came down there in person, would you let me talk to him?
In order for you to talk to him, you would have to schedule an appointment, sir.
Okay, why won't he call me back? I got a misdiagnosed x-ray here.
I'm not sure, sir. I'm not exactly sure what the reason with your call is either. I haven't been here the past few days. But I can... What was the reason? What do you need?
What do I need? I was misdiagnosed and your doctor's name appears on this report. I had head trauma, broken skull, almost died from this injury. Needed to be corrected, please. Sure.
This x-ray taken, yeah.
Okay, yeah, this was 2019.
Alright, let me go and see if I can get to him. And see if he can keep...
I mean,
you said you've already called up here?
I've been calling for the last 2 days. This is like so important.
Yeah, I understand you. I feel you. Here, give me one
Yeah,
second.
the way it seems is the doctor's trying to avoid me, and I want to know what's going on with this stuff.
I doubt that's the reason, sir, but let me go ahead and speak to him.
AFC Cahaba Village, how can I help you?
Yes, sir. Who am I speaking with?
My name is Sadler. I'm the office manager here.
Okay.
Cahaba Village location.
Yes, sir. I was waiting to talk to Dr. Blake Thomas, MD.
Okay. I believe the lady up front was talking with you, and I heard her say that he's in clinic, and that is true. So, is there anything I can help you with? I think they've mentioned your name before, and I think I have something right here from you.
Well,
from them when they've passed me some information.
Well, that's interesting because she never asked me for my name or my information.
I guess because you called the other day as well. I think you called the previous day or something like that, maybe.
Well, don't you guys get a lot of calls?
We do, yes, sir.
Okay, so how do you know who you're talking to?
Right now?
Yeah, I mean, shouldn't you ask me for my name and my information?
Yeah, I believe you. She mentioned that what you were calling about, and it rang a bell to me that you had called a previous day, and it reminded me that I had some information.
What do you think I'm calling about? What am I calling about?
You're calling about an X-ray that happened 3 years ago.
Is that an issue? I almost died from that injury, and I was misdiagnosed. You trying to insult me?
No. I was not insulting you. No, I was saying that's what the X-ray that you were, like the incident that happened 3 years ago. That's what you were calling about.
Yeah, it's an unresolved issue as well.
Okay.
So you want to know why I'm calling today?
Sure. Yes, sir. I'm trying to help you.
Okay, let me ask you a question. How can you help me? How do you help patients who are misdiagnosed usually?
Usually, I take your information down, I pass it off to who I need to talk to, and try to push it up the chains, and see who is available to do that, and who needs to be the one that needs to facilitate that.
Okay, well, I'll give you a summary of what happened to me. No problem. All right, so 2019, it was May, to American Family Care. That's Parkway, Roebuck, Birmingham, Alabama. I had very serious neck pain. I thought my neck was broken. So I went into AFC. I paid $175. I saw nurse Kimberly Kelly. And she directed me to have an x-ray done. Had the x-ray done. She stuck her head in the waiting area. Told me I was good to go. I had no injuries that showed up in this x-ray. Okay, I'm sitting there and I know I've got a broken bone somewhere in my neck. And I protested this. I brought this up to her. I was told to go to Cooper Green Hospital if I needed further treatment. So I got the copy of the records, all right? And here's what's interesting about those records, okay? Experity Doctor Anna Maria Eknick, MD-DABR. She's not in Alabama. She looked at this x-ray scan for American Family Care. And in her report, she also said I had no injuries. Now here's the issue. In those x-ray pictures that were taken at American Family Care in Birmingham, all right, there appears a very serious head trauma, broken skull, bone injury in the basilar area of my skull. It's in the occipital condyle, condylar canal, possibly my foramen magnum is also fractured. This is a very serious injury, and I almost died from this. I was misdiagnosed in this visit. Let's get to Dr. Blake Thomas. This doctor's name appears on my records as the supervisor to this nurse, Kimberly Kelly. Okay, that's why I want to talk to Dr. Blake Thomas. So this x-ray was misdiagnosed. I need to have this original x-ray acknowledged and as well looked at again, please.
So how did you? So you went to? Did you go to to another doctor after?
Okay. Okay. Look, it's like. Yeah, I've been to a lot of doctors and hospitals, sir. I'm not talking about any other doctor or hospital. I'm talking about Blake Thomas, Kimberly Kelly, Anna Maria Eknick, and American Family Care and Experity Teleradiology. That's who we're talking about today. There's a error that appears here, and it's on you guys. You guys are responsible, and you need to do your job correctly. Acknowledge that you did something wrong here, the error, and you just need to make this thing right. And I've already talked to people about this there. I mean, I've already answered these questions.
You saw Miss Kelly, Miss Kimberly Kelly, right?
Yes, sir.
Had the x-ray done, all that stuff. Visit was completed, and you were sent to, you were referred out to another doctor. Is that what happened? And you went to another doctor?
Yeah, I mean, yes, sir. Well, what's interesting about that visit is I was told I had no injuries. The radiologist came back and said that I had no injuries in the report. But here's a strange thing. If I had no injuries, I was then referred from this visit to an orthopedic doctor, bone doctor, and a neurologist. So if I didn't have any injuries, why was I given these referrals? And that tells me that, maybe something's going on that I'm not being told about.
Okay. Yeah, I mean, if they referred you out, I mean, that's not indicative of you having an injury. It's just that, we send you to specialists that are more specialized in dealing with, your issues that had that day.
Okay, well, you know.
Say, oh, I've got
Okay, but I mean, again, if I don't have injuries, why do I need to go to a specialist? It's $300. That's a lot of money to someone such as myself, sir.
Who did you see after? Who did you go to after leaving Parkway? Which one was the doctors after that?
Who was I referred to?
Yes, I mean, who you referred?
You should have that information in your records, right?
Yes. Okay. So yes, you were referred to a neurologist. Let's see. Referred to a neurologist, and then was let's see. Reading through here. Okay. After your visit, it was notified a patient to follow with ortho if pain persists.
All right. Yeah, I went to the orthopedic doctor. This is Perry L. Savage Sr. at Ortho Alabama Sports. Is that down there near Trussville? This visit, this was a total waste of time. And I took in other CT images and MRI scans that I had done around the same time, and he looked at these images with a straight face and told me that I had no injuries in these images, as well as the AFC X-ray. That the injury, it appears in that X-ray, and that's why I want to call and talk to the doctor, Blake Thomas, because if he's a doctor, he can look at those pictures and he can say, yeah, there's something there. I can see that.
All right, so. You say, okay, so I got it down that our images do show the injury.
Yeah, they do.
Yeah. Who was the CEO of Xperity Radiology.
Called in. Yep.
You went so after Dr. Savage, he looked you over and said you got no injuries. Who did you go to after that? Yeah,
I also went to the neurologist, Kyle Hudgens, MD, Grandview Neurology.
So he's at Grandview?
Yes, sir. $300 visit, cash. Yeah, so when I went to Kyle Hudgens, I also took in all the pictures, okay? I took in the images on the CD, took in the American Family Care images, took in other MRI, other CT that also show the same injury area. So Dr. Kyle Hudgens, he looked at my pictures as well, and he examined me. And he also said that he thought I had just strained my neck, and this is not the case.
Okay. So he said no injuries as well?
Yes, sir.
Okay.
I was referred by AFC to those doctors. Those doctors were no good because they didn't help me. It was a waste of my time and money.
Okay. All right, so after Dr. Hudgens, who did you go to after that?
Okay, so after Dr. Hudgens and after Dr. Savage, that's all the information I'm going to share with you, sir, because that's my extent of the referrals from AFC. So what I would direct you to do is inform the doctor and inform American Family Care the injury, it appears in those pictures, and they need to focus on that problem, trying to figure out what happened.
No, I understand. I feel terrible that if we missed it, then I understand that's upsetting. So, I want to make sure that I want to make stuff right. So I want to make sure I have my story straight, so that when I talk to who I need to talk to, that I can relay it effectively and
And another thing, I talked to a lot of people at American Family Care. I had a lot of obligations that people would call me, and my calls have never been returned. Been calling them here recently for the last month, since first week of April. So when do you think I'll get a call?
Well, I will push this up the chain today. I'll make some phone calls today and get some people on the phone today, and then before I leave today at 5, I'll call you back and let you know what I find out. If that's,
sure.
I haven't got a response back yet, I'll at least tell you that that's what I got.
Okay.
My name is Sadler, and I'm calling you back from the AFC. Just wanted to follow back up with you like I said I would at our earlier conversation, and try to give you some information that I found out.
Welcome to American Family Care. The right care, right now.
American Family Care, Cahaba, can I help you?
Yes, ma'am. Can I speak to Sadler, please?
What's the call in reference to?
Hey, I got a call from him yesterday afternoon, and he said he had a message for me. So,
do you remember why you called him? Like what? Like I said, what's it in reference to?
Okay, yeah, I had a misdiagnosed X-ray through AFC.
AFC Cahaba Village, how can I help you?
Got your message yesterday afternoon. Do you have some information for me?
Yes, sir. Hey, yeah, I just tried to give you a call back, and you were unavailable, unfortunately. So
Yeah, I was kind of busy. Sorry.
No worries. That's fine. That's why I left you a voicemail. So
Thanks.
You're welcome. So yesterday I did some digging. I called some of our internal customer service people and talked with them about your issue and what's been going on. And unfortunately, we're not going to be able to acquiesce to your request of any kind of letter, anything that you're after, unfortunately.
Okay, well, the problem is here, we've got money paid. I paid you guys to do a job, and the job wasn't done properly. And so you're telling me that your company, there's nothing you're going to be able to do about that.
I mean, you paid for the visit. I mean, the visit was...
Yeah, and I paid for an x-ray to be taken, and the x-ray was taken. I was misdiagnosed. Injuries appear. And so your job as a medical company, you're supposed to take care of people with injuries, and you didn't do that in my case. So you're telling me that there's nothing you can do about that?
Well, I mean, on our end, we did what we were supposed to do. We, as a primary care, urgent care, I mean, that's what we do. We see people that are, in an acute situation, and then we refer them out to specialists that are better designed to do the job for what your needs are.
Okay, well, your answer is not going to be acceptable because I had injuries. I came to your clinic to be treated for injuries. My injuries were not acknowledged, and so it's on you. And so this is your excuse. This is not going to be acceptable.
I'm not saying it's an excuse. This is what I've been informed that we're not going to be able to give you what you're asking for, which is a letter or something like that, whatever it may be.
Just do your job. That's what I'm asking for. You can't even do your job.
I'm sorry you feel that way. I mean,
It's the truth.
I laid out the entirety of everything for our customer service team.
Yeah, who did you talk to? Could you give me any names?
I cannot, no, sir.
Okay, do you have a first name?
Do I have a first name? I do, yes, sir.
Yeah, guys go by like code names or something like that. That's very unprofessional. I talked to someone named Astro. If I go to a bar or something, I talk to a bartender, like a female. They go by a name like that because they don't want males to hit on them, okay, or try to pick them up. If I go to a doctor's office, I need to talk to people with first and last names. That's professional.
Okay, we don't use code names. I've never heard of that in my entire life.
Okay, so you go by a single name. What's your first and last name?
I do not feel comfortable giving you my last name, sir.
Okay, well you're working in a job where you're dealing with the public. Okay, so I mean you should be pretty comfortable.
I understand that, but I mean your request for what you're asking for, we cannot give you. In terms of you saying that we failed to do our job.
You did.
Okay, well, I'm very sorry that you feel that way.
I won't be the only one who feels that way, that's for sure.
Okay, well, I do apologize for that you do not feel your care was adequate.
Yeah, and I mean, you guys are up there near Mountain Brook. I mean, this stuff is totally unacceptable.
Like I said before, we're not able to acquiesce to your request